Let's talk about the importance of jumping into action faster than you can say, "Where's the ice pack?" When an injury occurs, that immediate response is like the secret sauce for both short-term relief and long-term healing. Quick assessment? It's like finding the cheat code to level up your recovery outcomes. Now, diving into the mechanics of tibia fractures, imagine landing from a jump or twisting your leg like a pretzel. Yup, that's exactly how these unfortunate breaks usually happen. It's a perfect reminder that protective gear isn't just for show, it's essential unless you're aiming for a dramatic slow-mo fall worthy of a viral video. Speaking of injuries, think of something like Hutchinson's injury, which is kind of like the twin sibling of those seen in combat sports. Direct strikes can turn a match into a bone-breaking contest. Injuries across various sports might as well be part of an exclusive club, sharing the same pain and misfortunes. Let's highlight the tibial tuberosity, which sounds fancy but really just means a vulnerable spot on the bone where the patella tendon moonlights. This area is like the bouncer at a club. No muscle and no cushion means it's always on the lookout for trouble. So, if there's impact, it's bound to feel the pain. Now, after a tibia fracture, you're looking at a long-term relationship with rehabilitation. Think of it as the post-breakup self-care phase, but with more exercises and less ice cream. Understanding this injury is key to creating a solid treatment game plan. Otherwise, you might just end up binge-watching your recovery instead. Immediate injury assessment is like a first date. You need to figure out the severity of the damage based on a player's feedback and visible symptoms. And let's face it, if there's a deformity involved, that's a red flag worth noting. Nobody wants a partner with a broken leg. Now enter open fractures. These guys are like the drama queens of injuries. They risk infections and demand urgent medical attention, ideally with a side of antibiotics. Understanding the difference between open and closed fractures isn't just trivia, it's vital for the get well soon plan. Stabilizing a fracture is crucial, and luckily we have devices like air casts and vacuum splints, basically, the cozy pajamas for your leg. They mold perfectly, offering support while ensuring you don't turn that fracture into a comedic circus act. Alright, let's get down to some anatomical business. Recognizing the anatomy involved in tibia fractures is key for diagnosis. After all, the tibia is the weight-bearing champ of your leg, and without it, let's be honest, you're not going anywhere fast. Mobility and stability? More like your leg's VIP pass. So, treatment for tibia fractures often comes down to assessing severity. Is it a compound fracture? Are there complications lurking around like that one friend who can't take a hint? The urgency for surgical intervention really hinges on these factors. After all, no one wants to play surgeon when it's just a game of guess that fracture. On a brighter note, the prognosis for recovery from a tibia fracture is typically on the sunny side, especially when complications don't decide to crash the party. Athletes often bounce back and even return to play after rehabilitation. Just like those late-night pizza runs, they always come back for more. However, remember that injuries like ACL tears are like the bad breakup that keeps on giving, with serious long-term implications for players. We're talking about joint stability and cartilage health. It's like the gift that keeps on taking. So, whether it's a tibia fracture or ACL drama, it's always smart to keep those knees happy and healthy.